I'm Preet Gill, the Labour MP for Birmingham Edgbaston and the Shadow Secretary of State for International Development. I want to start by thanking Action for Global Health, their members and students for Global Health for hosting this webinar and for inviting me to speak, and I'm sorry that I'm unable to join you virtually in person. When I think about global health, I start by looking at the situation in the United Kingdom. British people are rightly proud of the NHS, created by a Labour government, and a world-leading example of universal healthcare that we are and should all be proud of. The NHS has allowed all of us to access quality healthcare free at the point of use, regardless of our income. But even with the NHS, during the COVID pandemic, we have seen how the UK has struggled with the health crisis. Imagine then what it's like for countries like Sierra Leone, where there are only 13 ventilators, or Somalia, with only 15 intensive care beds. For too many people across the world, their right to quality healthcare is far from realised. Accessible primary healthcare facilities remain extremely difficult for many to reach. 3 billion people around the world lack basic hand-washing facilities. And if recent trends continue, excluding the impact of COVID, up to 5 billion people will still be unable to access healthcare in 2030. And the UK has a vital role to play in championing global public health, and it should look at the value for money that investing in prevention and early intervention has. But part of this requires a political will. And the UK has had no global health strategy since 2013, and funding on strengthening public health systems has not been a priority. We now have a new department, the Foreign, Commonwealth and Development Office, which despite formally coming into existence 2 months ago, still doesn't have a strategic direction or priority areas. The whole process, to be honest, has been incredibly opaque. From the new department to where £2.9 billion of cuts to the aid budget have and will fall in this year, Healthcare for All is a vital step to create a better, safer, fairer world, and it is on all of us to make sure this remains high up on the agenda. Thank you to all of you who have taken the time to join us here today.